There are several reasons that testing for dehydration is important in our older population. One of them is it's very common. It's a common problem that often goes undiagnosed without any formal assessments. A lot of times the elderly will not feel that they're dehydrated. Unlike younger people who don't drink enough, they feel thirsty. The elderly may lose their sense of thirst, so they could be quite a little bit dehydrated without feeling thirsty and doing something about it. So it's very common. We have to formally screen for it in order to diagnose and detect it. Another reason is, as I said, it's sometimes very difficult. It doesn't always present in the same ways. There are many different symptoms that can result from dehydration, and we need to know what to look for. And it varies in different populations. For example, the clinic patient might present differently from a nursing home patient. And we need to know what to look for in all those populations. And the third thing is dehydration can lead to a lot of negative or adverse effects. Some of which, the common ones, would be things like kidney failure, falls. Oftentimes when you're dehydrated, you can get lightheaded or dizzy, and that can lead to falls, a very common problem, especially in our frail elderly, for example, nursing home patients. Mr. Johnson, I'm Dr. Hajar. Pleasure to meet you. Thank you for coming in.
Thank you.
What I'd like to do today is we have some questions. I'd like to ask you screening mainly for dehydration, for being a little bit on the dry side.
Oh, yeah.
That's a fairly common problem, and it's not always that easy to diagnose. So I've got a few questions about your diseases, your background, medical history, and some medications that you may or may not be on.
Okay.
Let me first start by asking about your medical history. Have you ever been diagnosed with diabetes?
Yes, I have type 2.
You have type 2 diabetes. How long have you had diabetes?
Oh, for about 20 years.
Diabetes, especially poorly controlled diabetes, if your sugars are over 200 persistently, the sugar itself can act as a diuretic and make you lose a lot of free fluids. You take medications for that?
Yes, I take metformin.
Metformin, excellent. I want to also ask you whether you have any swelling in the ankles.
Later on in the day, usually, it's fine in the morning, but later on when I've been, on my feet a lot, they tend to swell a little.
A lot of people have swelling in their ankles who will on their own start drinking or consuming fewer fluids during the course of a day, thinking that less fluids means less swelling, and that's not always the case. How about any bladder problems or control of the bladder? Have you ever had any accidents or?
Yeah, I've had a couple.
Have you? Over what period of time?
Like I finally get to sleep and over, well, I'd say at least for the past year.
For the past year?
It's just happened a couple of times.
Just a few times?
Right.
All right. Older males who have an enlarged prostate or females with an overactive bladder, anyone who has incontinent accidents, they may deliberately drink less fluids in order to produce less urine and therefore try to self-treat their problem by taking in less fluids, and that can put them at risk of becoming dehydrated.
Sometimes an hour later, I have to go again.
All right. And it interferes with your sleep.
Exactly.
There are several urine and blood tests we can use to diagnose dehydration. The simplest urine test probably would be just the color of the urine. Usually if you're taking in enough free water, enough fluids, your urine is going to be very diluted, so it will be pale. The less fluids you take in, the more concentrated the urine, the darker it will get. So on this samples here, someplace on this end, those dark urines will make us wonder or further look for dehydration. But a simple color test is fairly sensitive to dehydration. Mr. Johnson, I'd like to have a real quick look in your eyes and mouth.
Okay.
If I can have you look up. Usually no one test alone is diagnostic. Typically we combine a bunch of tests on exam as well as on blood tests. For example, a dry mouth certainly can be a sign of dehydration. Neck exam to look for jugular vein distension, that's not a sign of dehydration but of heart failure, having too much fluid in the lungs, which means you may or may not be on diuretics or water pills. Our nursing home patients have a unique set of problems. A lot of them clearly will be frail. They're dependent on other people for their day-to-day care, which includes nutrition and hydration. Some of those things also apply to hospitalized patients, where you can't just tell them to drink more and expect that to happen. They need, first of all, assistance in bringing them fluids, preferably things that they enjoy to drink, things that they like. There usually should not be any restrictions on our nursing home patients as far as what they drink. Even if they're diabetics and they like to drink milkshakes, we can always adjust their medicines, but it's more important to make sure they're getting enough nutrition and they're getting enough hydration and assistance with their hydration. What I'd like to do is take your blood pressure with you sitting down at first.
Okay.
I'm going to repeat it with you standing in a little bit. When you're dehydrated, or what we call volume depleted, your pressure can drop and your pulse can go up to try to compensate for a low blood pressure. We sometimes see that most pronounced when you change position. So when you're lying and you sit up, or when you're sitting up and you stand up very quickly, you can see a drop in blood pressure. Now, there are many, many things that can cause this drop in blood pressure, what we call orthostatic hypotension. Certainly medications can contribute to that. Malnutrition with low proteins can contribute to that. Heart failure can contribute to that. There's a lot of things, but certainly dehydration is one of the big things that can contribute to a drop in blood pressure. So for all those reasons I mentioned, the potential adverse effects of being dehydrated, because it's so common, it's very important to screen for dehydration, even in the patients that you might not think or they don't appear to be dehydrated. It's so much more important for patients who are dependent on their health, for nursing home patients, for hospitalized patients, for patients with advanced dementia. Those people require assistance with nutrition, with hydration. We need to have a general awareness that it is a common problem and we need to screen and treat it.